The people of Kenya must play their part in this campaign. And their part is to cooperate and take responsibility also. Take responsibility, because we must be our brother's keepers. We must conduct ourselves, each and every one of us as Kenyans must conduct ourselves in a manner that we assume we are infected. Given that this disease has a large number of persons who may be carrying the virus but are unaware of it, the so-called asymptomatic people with who are asymptomatic for the disease. We need, therefore, to conduct ourselves as though we are carriers of this virus. And to do that, we need to, one, protect ourselves, and we also need to protect others. Hence all of these measures of social distancing, physical distancing, wearing your mask. The intention there is that everybody is protected. Even if you have done a COVID test and are negative, maybe 2 days ago, you may never know 2 days later whether you have contracted the disease, especially if you are asymptomatic. You may never know. So the point that I think we're trying to take forward here is that as much as the government continues to communicate to Kenyans on the importance of adhering to these measures, fellow Kenyans, please also take the responsibility of taking up these measures very seriously and doing whatever is necessary to protect yourself and protect others. Turning to our COVID-19 situation. We have today tested 2,959 samples. Out of this, 143 have tested positive, which brings the total caseload of confirmed cases in the country to 1,888. And the level of testing that we have conducted so far is 76,000 are Kenyans, of which 110 are males and 33 are females, with the age range from 1 month to 88 years. The distribution of the new cases by county is as follows. Nairobi County has 86 cases, Mombasa County 25, Uasin Gishu 11 cases, Kiambu 6, Busia 3, Kwale 3 cases, all from Sambweni, Migori 3 cases, all from Kuria West, Kajiado 1 case from Kajiado North, Kisii 1 case from Bobasi, Garissa 1 case from Lagdera, Isiolo 1 case from Merti, Kericho 1 case from Ainamoi, and Makueni 1 case from Kibwezi West. Kericho becomes the latest county to record a case, bringing the tally of counties affected so far to 33. By the distribution of cases by sub-counties, let's start with Nairobi. In Nairobi, Makadara has 45, Kibra 21, Mbakasi South 6, Kasarani 5, Ruaraka 3, Westlands 2, Mbakasi West 2, Langata 1, and Starehe 1. If we look at Mombasa, the 25 cases are from Likoni 11, Mvita 9, Jomvu 2, Nyali 2, and Changamwe 1. In Uasin Gishu, all the 11 cases recorded there are from truck drivers from Tarbo. The cases in Kiambu are from Kabete, 3, 1 each from Juja, Ruiru, and Kiamba. In Busia, the 3 cases are from Alupe Mandatory Quarantine Facility, 2 cases there, and Malaba Point of Entry, 1 case. We are glad to announce that today we have discharged 26 patients from various hospitals, patients who have fully recovered from COVID-19. This now brings our tally of discharges, recoveries and discharges to 464. And again, we want to extend our gratitude to our healthcare workers who continue to do a great job for our people. By the distribution of cases by sub-counties, let's start with Nairobi. In Nairobi, Makadara has 45, Kibra 21, Embakasi South 6, Kasarani 5, Ruaraka 3, Westlands 2, Embakasi West 2, Langata 1, and Starehe 1. If we look at Mombasa, the 25 cases are from Likoni 11, Mvita 9, Jomvu 2, Nyali 2, and Changamwe 1. In Uasin Gishu, all the 11 cases recorded there are from truck drivers from Tarbo. The cases in Kiambu are from Kabete, 3, 1 each from Juja, Ruiru, and Kiamba. In Busia, the 3 cases are from Alupe Mandatory Quarantine Facility, 2 cases there, and Malaba Point of Entry, 1 case. We are glad to announce